For this episode of Therapyology Thursday, I'm meeting with Dr. Tonui so that we can talk about mental health and culture. So, like the intersectionality of the two. So, Dr. Tanui, please tell us a little bit about yourself.
Yeah, absolutely. Thank you for inviting me here today, Olivia, and I'm just so proud to hear what you're doing postgraduate program and a little bit about myself. As you said, my name is Betty Chinui. I'm an assistant professor at Oakland University. I've been there for 3 years now. A little bit about my educational background. I have a social work degree in both my bachelor's, master's, and now my PhD emphasis is also in social work. But my scholarship really focuses on doing research on mental health, more so specifically on immigrants and refugees that are living here in the States. Very passionate about mental health, and I'm sure we'll get into that a little bit later today. So, definitely.
So, what made you so interested in like the topics of mental health and how culture influences mental health?
Sure. So, I'm an immigrant woman from Kenya originally, and coming from that context, from that culture, I realized after being socialized here in the US, I learned that mental health is a completely different concept, right? We talk about mental health in a completely different lens and different view. And so, for myself, having my educational background, social work, we talk about mental health a lot. And so, I learned that there was a huge disconnect between what I was learning, but also how I was socialized. And
Mhm.
I wanted to understand more in depth about how culture really correlates to mental health, because it really informs a lot of the way we think, our worldview, or how we're socialized, and things like that. So I wanted to get deeper, and also during my master's program in social work, I did a research on immigrants and refugees, and I was also volunteering in the community. And part of my what made me sad to see was there's a lot of immigrants and refugees that were migrating from Africa, and some of them had endured a lot of trauma.
Mm.
And when I did the research, I realized that we didn't have a lot of evidence really informing, and I don't know if a lot of people, consider the literature, but for the sake of that project myself, I had a hard time finding literature that would help me understand more in depth about how we deal with trauma post migration. It's more specifically for immigrants and refugees, because again, being a social worker, I understood the symptoms and the signs to pay attention to, and having that volunteering in the community, I was noting a lot of disparities, and also how engaging refugees in terms of educating them about the nature and the system of the U.S.
Mhm.
And it started then, again, during my master's program in social work, to really wanting to do more and understand better, the Western approaches versus other approaches of looking at mental health. So
Mhm.
it goes back to, a couple of years back, again, in my social work program.
Yeah,
Yeah.
gotcha. And then I know that you were teaching like multicultural social work classes at OU because that's
Yes.
where I first took one of your classes.
Mhm.
And I really like that you touched on cultural competency, but as cultural humility. And so I
Yes.
just kind of want to talk about like what that means to you and what those two definitions, how they differ too.
Right. So I think in social work we talk a lot about cultural competency, right? And I think um as a professional, I've had to think a lot more about what that means for
Mm.
me. And in my point of view, I believe that cultural competency is really hard to meet, and it's really hard to be culturally competent, because when you think of culture, right, it's dynamic, it's changing, people are adapting, things, and so it's difficult to be culturally competent. But I like the concept that you're mentioning about cultural humility. I like that term much better, because when you're culturally humble or when you have cultural humility or approaches, basically what that means is that you are a lifelong learner, right?
Mm.
You are allowing yourself to adapt and to change based on the culture, how it's dynamic, how it's
Yeah.
constantly changing. And I think when we also think about in therapeutical relationships or when we think about in mental health, a big factor when it comes to being culturally humble is really thinking back and realizing mental health is such a unique concept. When we
Mhm.
talk about mental health, we're talking about the, mental health problems. We're talking about the signs and the symptoms, right? We have to express ourselves. We have to describe ourselves when we are having these interactions with people. And so when you think about it, if I am allowing myself to be an expert in the way I describe my symptoms, in the way I express myself, then I'm not being culturally humble, right?
Mhm.
We have to have cultural humility and say, people have been socialized differently. People understand this concept of mental health completely different.
Yeah.
And people also feel a certain way from their culture based on, is your culture allowing you to express yourself?
Mhm.
Because we know as individuals, and when you even think about culture, we think back of, individualistic cultures versus collective cultures, right? We express ourselves differently. And so when we say we're culturally humble, we're recognizing that people are unique. We're
Mhm.
also recognizing that individuals who come from individualistic societies versus collective societies are experts in their stories, experts in the way they express themselves, experts in the way they behave, even,
Yeah.
right? Because those are all of those behaviors and the mood, the feelings, and all those things all are interconnected to mental health and informs the way in a result informs the way we behave, right? The way we
Mhm.
think, the way we react, the
Mhm.
way we seek healing, all of that is all connected. And so again, I'm wrapping up with cultural humility. So the premise of this is being culturally humble is actually recognizing culture is dynamic and
Mhm.
allowing people to um,
Be the experts
be experts
and
in their stories. Yep, yep,
yeah.
exactly.
And I think that's why I like that concept of cultural humility versus cultural competence is
Hmm.
because it takes the focus off of you being the expert in
Yes,
someone else's story. Because I just don't think that it being cultural humble or practicing cultural humility is making it so that you have to be curious about somebody else versus
absolutely.
having it be your strive to be perfect in
Yeah,
their story, which
yeah.
isn't right. So
No, I agree with you
yeah.
there. Yeah, yeah.
Perfect. And then what would you say, like, how does culture influence mental health? Like, what is the dynamic between the two that you recognize most?
So, again, I think I would want to go back and think about what's culture, right?
Mhm.
We all have our own definitions of culture. Culture to me is completely different from you, right? But again, I think the basic definition of culture is our norms, it's our beliefs, it's our practices, it's our behaviors and things like that. So when you think of those things, there's a correlation between mental health and culture. So, for example, I've talked about expressing self. We're all socialized to express our emotions and feelings completely different. And this goes back to our, childhood. It goes back to how our parents even were socialized to learn about mental health, right? So it's almost like it's generational and given that it's generational, it also goes back to how informed are we about mental health.
Mhm.
So there's a deep correlation that is even beyond the cultures, like family. It's everything, right? So mental health and culture is completely connected in a way that if I'm expressing myself, and because we're talking about mental health, you have to express yourself to
Mhm.
be understood and also to know what's going on, right? And so if I'm expressing myself to you based on my culture, you you may or you may not relate with me given how I'm feeling, right?
Mhm.
And I'm going to express myself and describe the symptoms based on the culture, based on how I've been socialized. So there's a huge correlation between culture and mental health.
Yeah,
So,
definitely. Do you think that's important for just like general society to understand or only professionals?
oh, definitely. I think we all have to understand, and I think, for us in society, we have to be informed about how culture also influences mental health, because when you think about it, there's a lot of stigma around mental health.
Mhm.
And stigma is stemming from the culture, right? If you're telling somebody that they're crazy, right, or they're possessed with evil spirits, those are the belief systems within a culture. Those are how people perceive mental health within a culture, right?
Mhm.
And so a lot of times as a society, we have to be informed about the language that we use when we're talking to people or when we're talking about mental health, because it definitely influences people. And a lot of times you see that it shames people from seeking the help that they need. So
Mhm.
culture can be a positive thing, right? It can create a sense of belonging for people, but it can also create a sense of guilt and shame
Yeah.
given the language that we use, right? So how we label people, and if people are suffering, a lot of times we push them based on, again, the cultural norms, the cultural language that we use. And so I think we have to be informed on how are we talking about mental health around the people that are within our communities, within our social groups, within our friendship groups, within our whatever the case may be, right? We have to be aware of the language that we use, because that can either hinder people from seeking help
Mhm.
or create spaces where people are able to express themselves and actually receive the help that they need.
Definitely.
And I think that, as a society, that's just something that we have to be aware about. Now, as clinicians, I think clinicians, we also have, I'm not a practicing clinicians, but I've been trained in social work enough to understand that we are trained from the Western approaches, and that's our, our educational backgrounds, our understanding. We're trained to go and diagnose, right, to assess, to be able to make an accurate diagnosis,
Mhm.
right? That's our culture, that's our educational background. But then if you're going in the community and you are working with a client, let's say, for example, coming from a collective society, right, then you may often misunderstand what they're describing.
Mhm.
You may often misunderstand their feelings, right? And that can lead into misdiagnosis, for example. That can lead into miscommunication, for example. So, as clinicians, I think, or practicing clinicians, have to be truly be informed about the how culture influences mental health. And because that's the premise of how we diagnose,
Yeah.
using our judgment to see if a client has experienced, for example, depression, sadness, and those feelings, right? How often have they experienced it, right? Sometimes culture too, may inform the way people describe things. It may be from physical symptoms, right?
Mhm.
And clinicians might be trained to hear and listen to certain symptoms and signs from a particular way.
Yep.
And so oftentimes we could also miss that information based on how we've been trained educationally, right?
Mhm.
And so as professionals, being aware of that, and just learning how to integrate some of the cultural practices into clinical settings too can also create that atmosphere where uh, people feel empowered,
Mhm.
right? And things like that. So yeah,
Right. And I think that there's a lot of room for bias as
yeah,
far as when there is like this dynamic between mental health and culture. Because
mm-hmm.
especially if you are trying to only listen to family dynamics that relate to your own.
Yeah,
If you hear a dynamic that's different than your own, there's a lot of room for bias in there. So,
absolutely.
do you feel like there's anything that people as a clinician or in society can do to help counteract their bias when learning about different cultures and mental health?
Yeah, absolutely. I think it goes back to being culturally humble, right?
Hmm.
There's constantly something new to learn about culture. Like I said, it's constantly changing. Right now, we see the era of TikTok. Like
Hmm.
generations are changing, and so as we learn about culture and as we learn about our own biases, we have to remember that generations are going to have different patterns, right? Generations are going to have different knowledge and information about what mental health is, right? And I think as individuals, we have to be constantly learning about those changes and receiving trainings, going in the communities and being involved in the communities that we work with so that if we're doing the work and we're saying we're serving a particular community, then we actually understand what that community looks like, right? And maybe not just a community, a social class can inform a lot about how we render services and things like that. So I think creating that awareness and acknowledging the privileges that we have as individuals so that when we're serving a particular population, we are aware of our own privileges, right? Um, and we're able to recognize things. We may not always, right? Like you
Hmm.
talked about having bias. Sometimes, you may not control that,
Yep.
right? And so I think just creating that awareness of catching yourself constantly and saying, okay, maybe this is the way I was raised. Maybe this is the way I was taught. And maybe this is, things like that. And just asking ourselves, having this personal reflection and constant
Yeah.
reflection is very, I think it's important.
Mhm.
So,
And just being curious, like being
mhm,
curious about what other people feel and what they have to say about their feelings and their culture is really
absolutely.
important.
Yeah, I would agree.
So, what would be one thing, like one realistic thing that somebody, so one of our listeners or someone in the community could do to be cultural humble or to be more open to understanding the intersectionality between mental health and culture?
Yeah, that's a good question, and I think what we can take away from this conversation today is to consider that culture is a strength, right? It has its own strength, but it also has its own weaknesses. And as I mentioned earlier, culture allows us to belong, to create spaces where we can connect and share this identity with other people. Um, but also remembering as an individual, let us not use culture to hinder us from seeking the help that we need if needed, right?
Mm.
A lot of times there's these barriers of to accessing or seeking mental health. I've talked about stigma. So I hope that somebody that's listening to this podcast is reminded that culture is great, but do not allow culture to um, minimize or create a form of guilt or in you seeking the help that you need. This help out there, and there are people that are culturally humble, right? There are
Mhm.
people that are informed about others cultures and are trained enough to offer the services that are culturally relevant to individuals that are needing those services. And another thing that I would say to our clinician is again to continue reflecting on those cultural values, norms, and beliefs that are ingrained within us, but also continue learning about the culture of others, right?
Yeah.
And something that I continue to see in our even in communities, I mentioned that I do research on immigrants and refugees, and we often see in the literature a lot of misdiagnosis. Participants in research often talk about being misunderstood,
Yeah.
and I think clinicians that are listening to this podcast, I hope that also, if you're working with clients who have different languages coming from different backgrounds, and I should emphasize that language is not only for individuals who speak a different language. language also goes back to the social economic status of that
Mhm.
particular client that you're working with, right? So
Yes.
a lot of times it's
Mhm.
not just about people who speak or do not speak English. It's about the language that's used in mental health. It's could be, um,
Nuanced.
yeah, it's
Mhm.
very new to a lot of people, right? And so paying attention to those things and being mindful about those things, so that again we can minimize the misdiagnosis and miscommunication that we see, especially widely documented across the literature. So that would be my
Yeah.
message.
Good. Anything else you would like to add to this conversation that you feel is vitally important?
No, I'm glad we're having these conversations, honestly, because it's much needed.
Mhm.
And I think what you're doing is really going to reach a lot of people. And I hope that, you know, people can benefit from this conversation and be informed. I think education is such a valuable tool in
Yeah.
really seeking help and receiving help. And I hope that, people don't just think that you have to be diagnosed with a mental health disorder to be struggling, right?
Mhm.
It's okay not to be okay. And I hope people are informed that we're all vulnerable to mental health,
Mhm.
right? Life, transitions, things can happen that can affect our own mental health.
Mhm.
And just because we're overwhelmed and we're tasked with a lot of things, I hope that we understand that anybody's vulnerable to
Mhm.
this, and it's okay to stop and say, I'm exhausted, I'm overwhelmed. What can I do, right?
Mhm.
So yeah, I mean, taking care of ourselves too, and recognizing the things that work best for us, because mental health is unique to all of us, and
Mhm.
so when we understand the ways that we can use to cope, and not just diagnose ourselves and just seek,
Mhm.
for example, as I've seen individuals seek spiritual care, and you know it's important to have that, but it's also important to seek beyond just informal support,
Yeah.
going beyond that, and seeking the professional help is okay.
Yeah, I
Yeah.
love that. It's
So
amazing. Well, thank you so much for coming here and joining us because it's just really important to have people who are actively involved in research this stuff to help us better understand it. So,
absolutely.
thanks.
Yeah, thank you.